I'm Dorothy. I'm a student EEN, and I'm going to go through some information on gestational diabetes with you, if that's okay.
That's fine.
Okay, so gestational diabetes occurs in about 35,000 women in Australia every year. And for most women, it actually ceases once the baby is born. So it's not something that's typically going to be ongoing for you or for the baby. So diabetes is when there is too much glucose floating around in your blood. So normally what happens is the glucose in your blood will go into your cell to give you the energy to do all the things that we need to do. But if there's a shortage of insulin, or the insulin is not working properly, the glucose can't get into the cell, and that causes an excess of glucose within the blood. So that's what diabetes is. So gestational diabetes is just diabetes that you have whilst you're pregnant. Now, how that can occur is obviously the placenta normally will feed the baby, help the baby grow and things like that. But with that, it sort of disrupts some of the hormones within the body as well, and that can cause the gestational diabetes. As a result of that happening, your baby can actually grow larger. Doesn't mean by any means your baby is going to have diabetes when it's born, okay? But it does usually mean that baby will grow larger. So as much as, okay, a larger baby, not too bad, it can have implications for you whilst you're pregnant. It can cause things like high blood pressure. And obviously when it gets time to giving birth, it can cause complications there as well, to the point that it may be suggested that you have a cesarean section, or if your obstetrician knows that your baby's quite large, they may actually induce you a few weeks earlier. But just be rest assured that when the baby is born, it won't have diabetes. It will be monitored for 24 to 48 hours just to make sure that its own blood glucose level does return to normal, because it has had that extra insulin going through the placenta from you. So the best thing to do for you going forward living with this is to obviously monitor your blood glucose level, and we'll have someone go through that. Usually a diabetic educator will go through that in more detail with you. But also look at your diet and your exercise. So what we're talking with diet is making sure that you're not having overly sugary foods, soft drinks that are high in sugars, all those sweet yummy things that we like to have that are high in sugar. Try and reduce those as much as you can. Certainly have as many high GI foods as you can, low GI foods, that you can, because they will help monitor your blood glucose level, but they also help you feel fuller for longer as well. Exercise is a good thing that you can do as well. So doing things like swimming or walking. You don't have to do anything strenuous. You don't have to go out and sign up to anything, but just going for a daily walk, or if you enjoy swimming, going for a swim. They're all things that will help not only with your diabetes now, but actually will help keep you fit and healthy for your birth, and then obviously following the birth of your baby as well. You may need to have medication, and that will be up to your endocrinologist when you see them as to whether they want to do that. Generally, it is an insulin injection. Don't be scared by that. You'll be sort of talked through and explained how that will be done. But that's the usual way that it is monitored or help to manage your gestational diabetes. Sometimes a tablet can be given, it's called metformin, but that's only sometimes. It's generally an insulin injection that you'll be given to help with that. So just keep yourself fit and healthy during the pregnancy. As I said, once the baby's born, the baby will be monitored for that 24 to 48 hours to make sure it's okay. Generally, your insulin levels will return to normal as well. You may have a possibility of down the track developing diabetes, and that's just as a sort of a byproduct of having the gestational diabetes. Your baby is going to be more prone to that as well down the track. Not as a baby, you don't need to worry about as a baby. It will be a fit, healthy, normal baby, but down the track it is going to have a high chance of developing diabetes mellitus as well. You are at a higher risk of developing gestational diabetes if you've had it before. So it depends on whether this is your first pregnancy or further pregnancy. If someone close to you, like your mum or your sister may have had it, If you're sort of a little bit overweight, well, no, I shouldn't say a little bit. If you are overweight for your, size, your height and your age, that can actually be a cause of gestational diabetes. It depends on what your ethnicity is as well, because that can actually have implications on whether you're at risk of developing gestational diabetes, as is if you're over 40, you have a higher chance. And if you've had any gynecological problems in the past as well, that can actually may cause you to have gestational diabetes as well. So what I've got here is just the National Diabetes Service Scheme have got a couple of pamphlets that I think are really useful that I'd like to give to you. One is actually on caring for yourself and your baby whilst you're pregnant, and the other one is sort of after you've had the baby. So just be mindful to look after yourself, exercise, diet. Another thing with your diet, we will refer you to a dietitian. There is some spots in here to actually put your appointments for endocrinologist, dietitian, your next GP appointment and things. But with your diet, try and eat more often rather than have the normal sort of 3 meals that we tend to have. Try and eat smaller meals more often. And you'll see in here, but I've brought this as an example as well. Try and have like half of your plate, whatever size plate you have half of it as your vegetables, a quarter carbs, and a quarter protein, and that will just keep your body working to its best possible function that it can. So I know that's probably a lot of information for you to take in. Do you have any questions at this point?
So will I have to see a dietitian straight away?
We will organise an appointment for you before you leave here. And the best thing is to actually get onto that as quickly as possible so we can actually make sure you're on a good diet for you going forward.
Will you also make the endocrinologist appointment for me, or will I have to do
We'll do that while you're here as well. Your GP sort of recommended who he would like you to see. So we'll organise that for you, and we'll just pop it on that front sheet that I showed you where all your appointments go. So you'll have it all there. You can go away knowing everything's done. You'll be able to see when your next appointment is. You can read through this. If you've got any questions, you can jot them down. It might prompt you reading through this to ask some questions as well. But if you do that, then when you see either your GP, endocrinologist or dietitian, you'll be able to ask those questions of them.
Great, thank you very much.
Okay, is that, you sort of feel that you've got everything okay?
I feel very comfortable. If I have any questions, I will write it down.
Excellent, thanks Kate. Nice to have met you by the way.
You too.
Thanks.
Thanks.